Hi, welcome to the Backpack Project. Here we're going to show you some simple things you can do in this EHR to learn how to get around. I'm going to go ahead and log in with your username and password. Now, once you've logged in, you'll land on the calendar. The calendar looks like this by default. This is not a properly set up calendar. If you're a provider and you want to set up your calendar properly, what you want to do is click on the time frame on the calendar and you want to go to provider, and then you want to you're going to set your in-office time, and I'm going to tell this to repeat every day, and you must give it an end date. If you don't give it an end date, it won't set. So I'm going to go ahead and set it for this year. End date will be, oh, also don't set it past 2 years because it will make your calendar really slow. So these are things you would want to set on a yearly basis and to keep the calendar flowing smoothly. So I'm going to go ahead and save this. Now you see this blue background. That means that the calendar is set up properly. And when someone is trying to schedule an appointment, the system will check and see if that slot is available, and it will go ahead and it won't stop you from scheduling an appointment. It will just warn you that that slot is not available. And do you still want to go ahead and schedule the appointment? You can go ahead and schedule the appointment if you know for sure that that's going to work for the provider, because some providers do double book. Now, as far as bringing a patient into the system, you want to there's a couple ways to do it. If you go to Finder, okay, I'm going to show you my favorite way to do it first. If you go to Finder, you can see all the patients that are in the system and you can look for them by name. And let's go, and we can see that there's a couple of patients here. And what I want to do is, if the patient I'm looking for is not there, I'm going to click on Add New Patient. That's going to bring me here. Now, you can get to the same screen if you were to do the patient and new search. Now, some people like this view better, just to go here. And if you were to click here, and I'm going to put in again, and scroll down and tell it search, it'll search for him as a first name and let me know that there isn't any. So I will go ahead and add Hamburger as the new patient. Oh, for a new patient, you're going to need name, first and last name, date of birth, and the date of birth, you're going to have to be careful how you put in the date of birth, because the system, unless we got it set for accepting slashes, by default it's year, month, day. So I'm going to scroll back to 1972, and let's just do January 5th. So as you can see, I put it in year, month, date. There is a setting in the config that you can change this so that you can put it in year, month, date, or month, day, year, or whichever format you want to put it in. And then you want to select gender. Alright, and then I'm going to go ahead and now any of these other information, you can go ahead and add them if you have time to do it, but if you're in a hurry, just want to get the patient into the system, you can go ahead and skip all this and come back to it later, because once I tell it to create new patient, it's going to check and see if Hamburger is in there, and if Hamburger is not, then it's going to ask you, do you want to create new patient? So I'm going to tell it yes, create new patient. And it brings me into Hamburger's chart. And yes, it says happy birthday, even though it's not. I think that's oh, actually it is. Sorry. I put it as January 5th, so that is today. And, oh, my bad. All right, so let me go ahead and close this. Now, when you land on the patient's dashboard, you have quite a few things that are available to you, pieces of information. And I won't go through all of these at the moment, but there are, just kind of scroll up and down. Some of them are self-explanatory, and like if you want to put in the patient's insurance, you want to go ahead and click on edit, and then you have to scroll down to get to it. Alright, and so when you scroll down, then you can go ahead and put in the insurance company. You can select one that's already in the system, or you can select new search ad. Sorry, I almost said new search ad, but it's just search ad. And you can put the insurance company in this way as well. So I'm going to go ahead and cancel this for right now, and I'm going to go ahead and just select the one that's in the system. And of course, you want to put in your plan name, as much information as you can about the patient. Now, because we didn't put in the rest of the patient's information right now, we can't finish filling this out. So, like the contact information, you know, the address, and okay, let's go ahead and do that. Go ahead and be lazy and select that. And of course, you can put in all of the contact numbers that you want for the patient. And also, you got guardian information that you can put in. And these fields are all configured. Yeah, can be configured. Well, configured. And they can say different things, or you can take them away. It's totally up to you guys how you want these choices to look like. If a patient's going to be, if you're going to be using the patient portal, under choices, you're going to need to do the allow email, and you want to allow patient portal. And the reason these are not set by default, and everybody asks this question, can't we just default these to yes? Yes, you can, okay? But according to the HIPAA rules, you're supposed to ask the patient, and if you don't, if it's defaulted to yes, then nobody asked the patient if they wanted this. So then you may get a patient that is getting information that did not want it, and they may complain. Just thought I'd throw that out there. All right, so those are the pieces of information you need in order for the patient portal to be utilized by a patient. And if I go ahead and save this, it brings me back to here. Portal credentials are set up right over here. So if I go ahead and click create, it's going to do this. It'll create the credentials. Now, it should email these credentials to the patient if the system is set up for email outbound. And when I do this, okay, so right now it's not configured properly to send out email. Oh, sorry, we got to go configure the portal. I know what's wrong right off bat because this is incorrect, and there's some other things that's probably not set up. But anyway, this is what it would look like, and this is the email that the patient would get in order to log into the portal. The portal credentials will allow them to, of course, see their records. Let me cancel that for the time being, and let me close that. And let me go here. That's not anything you need to worry about. All right, so when you are ready to see a patient, you can, there's a couple ways you can do this. A patient does not have to have an appointment on the calendar in order to be seen by a provider. Okay, I'm gonna say that again. So a patient does not have to have a appointment on the calendar to be seen by a provider, because you can just simply go to encounter. The encounter is where all the documentation is gathered together for a specific visit. So this system is visit specific or visit centric. All right, so we're going to select the category, and I'm just going to say new patient because it's a new patient for right now, and type, okay, let's say new patient, and let's go 40 to 45 minutes. Now, some of these things you can forego, and the visit reason here is going to show up on the fee sheet, okay? Okay, so when I put that there and go ahead and save that, now I have a visit ready to do my documentation. In order to do my documentation, I would select the form that is needed for this particular type of visit. I see there's a few forms in here, so if we do I'm just picking one at random. All right, that's not done. And I'm going to try picking another one at random and see what happens. Okay, so we have this form here that we can fill out for the patient's visit today. Also, if I just click that tab there, I can go ahead and do a GAD 7 for that patient. Okay, or I can, if you notice, those tabs stay there as long as I leave them open, and it's not till I save that document that it's actually going to disappear off of the tab list here. So I can go through and fill out this form for my patient. And there we go, save that. And as I said, it disappears after that. So I'm going to go ahead and do a couple more of these. And so, and it doesn't matter, of course, which documentation you're filling out. You would fill it out according to what the patient is being seen for. So I'm going to save this form. And now I have one more to do, which is this one. This is interesting. And what happens after you do these? And I'm going to select that one, and then yes, and save this. Okay. So now, as you can see, those are all the documents I filled out for this patient that shows up on the patient's chart. Now, if I were to go and refresh the screen here, you can see I see these forms here as well in the summary view of the encounters. If I mouse over, if I mouse over the document, it will give me a brief on that document. It will show it to me. So if I do the next one, oh no, that's the form itself. Let's see. If I mouse over this one, or if I mouse over this one. Okay, so as you can see, it gives me a brief of the document, so I don't necessarily have to go into the encounter to see what was filled out for that patient. Now, the next thing you're going to have to be familiar with at this point is billing. So now there are things we can do for the billing at this point. Right now, let's skip over that. We're going to manually do the billing at this point. So I'm going to go back into the encounter itself, and I'm going to go to administrative, and I'm going to select the fee sheet. And when I select the fee sheet, okay, now we got some configuration to do here to make this easier for those that need to fill out the fee sheet. And again, there are some shortcuts that we can build in here to make the filling this out, or you don't have to come here at all. But in the meantime, we're going to go ahead and just select a couple of things. And I'm going to go ahead and select an ICD-10, something I'm familiar with. Not that I'm a patient anywhere. Okay, let's go ahead and select that. Now you have the basis for your billing. You're going to go ahead and justify that. There's no prices in the system at the moment, so we're going to put a price in there. And this is the basics of billing for a patient. Yes, you can put more, up to 9 ICD-10s. You can put more CPTs. This is just for a brief of how this gets done. So go ahead and save this, and it will close out. Now, where did that go? If I go to fee and go to billing manager, and there it is. Now, this is where I can review the visit, the encounter, and let's see, ECW, and we got that insurance company. So now all I would have to do is select that, go here, generate, and I can do a validate and clear or a validate only. If I do validate only, it's going to show me this, and then this is my scrub log. Okay, so it's going to tell me what's wrong. Here's hamburger here at the top. All right. So hamburger is telling me that the insurance missing last name, insurance missing first name, insurance missing policy. So these are things that need to be fixed before we can send out a clean claim. All right. So I'm going to close that and close this, and then go fix those items, and that should make the claim either go out. So once I fixed all those items with the claim, I would come back here, select this, and then go to continue. If I select continue, it's going to go ahead and generate the X12 file. Now I'm not for sure if your system is set up to automatically transmit claims, but I can find out real quick. If I go here to fees, yes I am. So if you go here and then go to claim tracker, all right, it's waiting to transmit the claim to the ECW, and this is the batch file for the claim to go out. So that's the short version. There's a lot more to the system, of course, that I can tell you about, and we'll probably do it in subsequent videos, because like these transaction forms here, and transactions are like referrals and things of that nature that you would send out and get back. So if I create a new transaction here, I would either do a referral or billing or legal, and of course you can add transaction forms. Transaction forms are not are something that doesn't need to be a part of the patient's documentation for their visit, but needs to be in their chart as a one-time fill out for specific items, or I hate to say the word again, transactions for the patient's chart. Okay, so those can go in there, and that's what transactions are for. Documents are just that. It's where you can go and you can upload external documents to the systems. You can upload PDF, Word docs, text documents, and you just have to make sure you allow those particular documents. Anything that's uploaded from the portal will show up under here, under patient and reviewed or not reviewed. And right now, because you don't have anything in the portal, over on the right here under the, what's that thing called? Your profile picture, there would be another item here that would show you if there was anything in the portal for to be reviewed. If I go here, this is too much, but let's see. If I go to portal, which is here, okay, so the portal is enabled and it's all set up with the reCAPTCHA, so it's ready to go. It just needs the right IP address or the right domain name here for the portal. So you would put in backpack and you would get rid of this. There we go. And I'll go ahead and save that. It's just bothering me. I went ahead and did it. Okay, so those are some of the things I can share with you about this. We'll go into more detail about the patient dashboard and some of the items that are on the dashboard, like the patient ledger, issues, history, and then the external data. Actually, I have no idea what that does. It's been there a really long time, but I've never used it. All right, that's all I have for you right now. Talk to you later.